Welcome to this explainer. Today, we're taking something that honestly looks pretty dense on paper, the 2021 AHA Veterinary Nutrition Guidelines, and we're turning it into a highly actionable, process-based clinical journey. No fluff, just the facts. If you've ever felt totally overwhelmed by the sheer volume of nutritional data out there, well, you are in the exact right place. We're going to break it all down. Let's take a quick look at our agenda for today. We'll be covering 1. The fifth vital assessment. 2. Screening versus extended evaluation. 3. Building the nutritional plan. 4. Navigating client conversations. And 5. Timely nutrition controversies. Section 1. The fifth vital assessment. A paradigm shift in patient care. So we're starting with a massive paradigm shift. What actually is this fifth vital assessment? Well, it's the practice of evaluating a pet's nutritional status at every single examination, right alongside temperature, pulse, respiration, and pain. Why are we doing this? Because proper nutrition is absolutely essential for longevity and managing chronic conditions like osteoarthritis or kidney disease. It demands the exact same immediate attention as checking a patient's pulse. It's not just an afterthought, it is literally a critical vital sign. Now, a true nutritional assessment is kind of like a giant puzzle. You have to evaluate 3 overlapping interconnected pieces: the animal itself, the specific diet they're eating, and the feeding management, so their home environment. If you miss even one of these, you're missing the complete picture. You can't just know what's in the bowl, right? You have to know who is filling the bowl and how the patient's body is actually responding to it. Section 2. Screening versus extended evaluation, the exam room protocol. Think of this as your triage system. Every single pet gets a rapid screening evaluation. It's highly practical for a busy clinic because it ensures no patient slips through the cracks. Now, only if specific nutritional risk factors pop up, things like abnormal weight, an unexpected weight change, or systemic disease, do we actually hit the brakes and trigger a more comprehensive extended evaluation. It's an incredibly efficient way to allocate your clinical time exactly where it's needed most. When you're doing that physical screening, we look at 2 major scores. Here's where it gets really interesting, understanding the difference between them. Body Condition Score, or BCS, evaluates body fat percentage. Muscle Condition Score, or MCS, evaluates muscle mass over the spine, skull, and pelvis. These 2 things are not causally related, so they have to be scored separately. Think about it. A significantly overweight pet can actually be suffering from severe hidden muscle loss. You absolutely have to get your hands on the patient to score both of these accurately. Digging a little deeper into muscle loss, we have to make a clear clinical distinction between cachexia, which is muscle loss associated with disease, and sarcopenia, which is muscle loss associated strictly with aging. Both of these conditions severely affect patient outcomes, but recognizing exactly which one you're dealing with changes your entire approach. With cachexia, you treat the underlying disease, but sarcopenia? That requires a completely different management strategy focused on helping the pet age gracefully. Section 3, Building the Nutritional Plan, Doing the Math. Okay, so we've assessed the pet, now it's time to build a highly individualized plan. So how do we figure out exactly how much a pet should eat? Well, no more guessing. Eyeballing portions is exactly how we ended up with the pet obesity epidemic we're seeing today. Instead, you calculate the resting energy requirement based on their ideal weight, and then multiply that by a specific life stage factor, like are they a neutered adult, actively growing, prone to obesity, and that gives you their true maintenance energy requirement. It takes the guesswork completely out of the equation. Now, I know the math might look a little intimidating at first glance, especially when it involves calculating kilograms to the power of 0.75, but here is a fantastic clinic hack for you. You can calculate the complex part of the RER equation using just the standard scientific calculator on basically any smartphone. Just pull it out, turn your phone sideways, type the weight in kilograms, press the X to the power of Y button, type 0.75, and boom, you're done. It is literally that fast, right there in the exam room. When you're finalizing this plan, just keep a few core rules in mind. First, weight loss calculations absolutely must target the ideal body weight, not the current obese weight. Second, treats cannot exceed 10% of total calories. Any more than that, and you start diluting essential nutrients from their primary diet. Also, definitely implement food dispensing toys to help control intake and mentally stimulate the pet. And lastly, always adjust diet transitions gradually over 4 to 7 days to avoid any unnecessary GI upset. Section 4, Navigating Client Conversations, the Human Element. So the math is done. Now we reach what is arguably the trickiest part of the whole visit, actually communicating these recommendations. Clients often view food as a profound, daily expression of love for their pet, right? To prevent them from feeling judged or assuming you're just trying to sell them a bag of food, use this framework. It advises completely separating the clinical healthcare recommendation from the commercial product recommendation. First, get them on board with the medical need for a diet change, the why. Only after they agree to that strategy do you introduce the specific brand to execute it. And how you ask a question completely dictates the honesty of the answer you'll get. Starting off with a closed-ended question like, "What kind of food are you feeding?" is proven to encourage defensive, one-word responses. An open-ended inquiry, on the other hand, yields a vastly superior clinical history because it actively invites the client to share their actual daily routine with you. Let's put this into practice. You can get a much more accurate nutritional history by asking about extra foods or snacks rather than using the word treats. Think about an owner who's overfeeding their dog out of guilt because they work long hours. The word treats often triggers that guilt and shuts down their honesty immediately. But a neutral phrase like, "What extra foods do they get?" removes the judgment completely and opens the door for a real, honest conversation. Section 5. Timely nutrition controversies. What clients are asking. We are going to impartially review the guidelines' clinical stance on 4 major dietary trends. The goal here isn't to take sides or get into an argument with a client, but simply to equip you with evidence-based responses so you can relay what the clinical data actually says. First up is diet-associated DCM. While the research into diet-associated dilated cardiomyopathy is definitely still evolving, the current evidence suggests a conservative approach. Avoid grain-free diets and avoid diets high in legumes like lentils or peas. This is especially important because getting a definitive diagnosis for this heart condition requires an expensive echocardiogram that a lot of owners just can't afford. Prevention really is the most practical path forward here. Then there's the big one, home-prepared diets. If a client absolutely insists on cooking for their pet, they should be referred to a board-certified veterinarian nutritionist. Why? Because the research shows that even recipes written by veterinarians are frequently nutritionally unbalanced over the long term. The vast majority of what clients are pulling off Google or Pinterest just does not provide complete and balanced nutrition, no matter how well-intentioned they might be. Now, when it comes to raw protein diets, the guidelines are clear. Raw diets significantly increase the risk of bacterial transmission to both pets and humans. It's also really vital to bust a very common marketing myth right here. You have to educate clients that high-pressure processing, or HPP, on commercial raw food labels absolutely does not equate to a completely sterile, zero-risk product. And finally, let's talk about age and breed-specific diets. Giant braids obviously need careful growth management up to 16 months to maintain a lean body condition and avoid excess calcium. But surprisingly, if we look at the exact opposite end of the spectrum, there is absolutely no universal consensus or AFCO standard for what actually makes a senior pet food, which means a healthy older pet can often stay perfectly fine on their standard adult maintenance diet. Conclusion: empowering the veterinary team and the client. Bringing it all together by understanding the math, the medical risks, and the underlying psychology of how we talk to clients, you are totally equipped to make nutritional intervention a collaborative success. So I'm going to leave you with this final thought to reflect on tomorrow when you walk into the clinic. Is your practice truly treating nutrition as the life-saving fifth vital assessment it was always meant to be? Thanks so much for joining me for this explainer, and keep learning.